Each year, millions of adults over the age of 60 lose at least one tooth that might have been preserved with earlier attention to gum health. According to data from the Centers for Disease Control and Prevention, nearly 70% of adults over 65 show some level of periodontal disease. Most people assume tooth loss happens because of cavities, yet in older adults the more common cause is progressive gum recession and bone loss. Gum recession does not happen overnight, and that is exactly why it is so dangerous and so often ignored. The gum line slowly pulls away from the tooth, exposing the root surface that was never designed to face the outside environment. When that root becomes exposed, sensitivity increases inflammation, deepens, and the structural support of the tooth begins to weaken. By the time pain becomes obvious, the process has usually been progressing quietly for years. This information is provided for educational purposes only and does not replace examination or treatment by your dentist or physician. If you are currently under dental care taking prescription medications or managing chronic conditions, you should always speak with your healthcare provider before starting supplements or new routines. Understanding the real reason gums recede is the first step toward protecting the teeth you still have. Many adults brush gently, floss carefully, and rinse faithfully, yet still watch their gums recede year after year. The issue often goes deeper than hygiene habits alone, especially after the age of 50. Research published in the Journal of Periodontology shows that collagen production declines steadily as we age. Collagen is the structural protein that gives gum tissue its thickness, firmness, and ability to cling tightly around each tooth. After age 50, collagen synthesis may decrease by approximately 1 to 2% each year. That gradual decline might sound small, but over a decade it becomes significant. When collagen weakens, gum tissue becomes thinner and less resilient against daily chewing forces and bacterial irritation. At the same time, low-grade chronic inflammation becomes more common with aging, which accelerates collagen breakdown. Studies from the National Institute of Dental and Craniofacial Research indicate that bone loss in the jaw is a key driver of advanced gum recession. Gums do not float independently around teeth, but instead depend on the bone beneath them for support and attachment. If the jawbone begins to thin or lose mineral density, the gum tissue above it inevitably follows that downward shift. In simple terms, gums follow bone, and without a strong foundation, they cannot remain securely in place. This is why treating surface bacteria alone often fails to stop long-term gum decline in older adults. Many people focus only on killing bacteria without addressing tissue repair and structural rebuilding. Antibacterial rinses can temporarily reduce harmful microbes, yet they do not automatically restore lost collagen. Another common mistake is using products that contact the gums for only a few seconds before being rinsed away. Injured tissue requires sustained exposure to beneficial compounds in order to stimulate meaningful repair. Short contact times may help with cleanliness, but they rarely activate deeper regenerative processes. A third overlooked factor is nutritional support, especially amino acids and micronutrients required for collagen synthesis. Fibroblasts are the specialized cells responsible for producing new collagen fibers in gum tissue. When fibroblasts lack adequate raw materials or energy, their repair capacity becomes limited. More than 3,000 studies on connective tissue biology confirm that tissue regeneration depends on nutrients, oxygenation, and inflammation control. Without those foundational elements, even the best brushing routine cannot fully reverse gum thinning. Understanding these biological principles allows us to evaluate supportive strategies more realistically and responsibly. The following strategies are presented in ascending order of overall potential benefit based on current research and biological plausibility. They are not miracle cures, but rather supportive tools that may complement professional dental care. Consistency and patience remain essential for any meaningful improvement. 7. Nighttime mouth, taping, and xylitol. Many older adults unknowingly sleep with their mouths open, which reduces saliva flow overnight. Saliva is not merely moisture, but a protective fluid containing enzymes, antibodies, and minerals that defend gum tissue. Chronic mouth breathing has been associated with increased gum inflammation and recession in clinical observations. A study published in the Journal of Clinical Periodontology noted higher rates of gum recession among habitual mouth breathers. Gently encouraging nasal breathing during sleep may reduce dryness and irritation of gum tissue. Medical-grade mouth tape is sometimes used for this purpose, though individuals with sleep apnea or respiratory issues should consult a physician first. Xylitol, a natural sugar alcohol, has been shown to reduce levels of Streptococcus mutans in the oral cavity. By limiting certain harmful bacteria, xylitol may support a healthier nighttime environment for gums. However, this approach primarily prevents additional irritation rather than rebuilding lost tissue. It may serve as a protective habit, but it does not directly regenerate collagen or bone. 6. Warm salt water with diluted tea tree oil. Warm salt water rinses have been used for generations to soothe inflamed oral tissues. Salt solutions can temporarily reduce swelling and draw out minor irritation through osmotic effects. Research from the Indian Journal of Dental Research suggests saltwater rinsing may modestly reduce gum inflammation. Tea tree oil contains compounds with antimicrobial activity against certain anaerobic bacteria found in periodontal pockets. When properly diluted, it may enhance the antibacterial effect of a rinse. However, contact time remains limited because the solution is typically swished and expelled within 1 minute. Short exposure may clean the surface but does not provide sustained stimulation of repair cells. Undiluted tea tree oil can irritate sensitive gum tissue and should never be applied directly without dilution. This approach may help with temporary cleanliness and mild inflammation, but does not address deeper structural decline. It should be viewed as supportive hygiene rather than a rebuilding strategy. 5. Topical green tea or matcha application. Green tea contains epigallocatechin gallate, commonly known as EGCG, which has been extensively studied for anti-inflammatory effects. EGCG can inhibit certain enzymes that contribute to collagen breakdown in connective tissue. A clinical study published in the Journal of Periodontology observed modest reductions in periodontal pocket depth with topical green tea application. Drinking green tea may offer systemic benefits, yet it does not provide prolonged direct contact with gum tissue. Creating a paste from high-quality matcha powder and applying it briefly to the gum line increases local exposure. This topical method may support collagen preservation by limiting destructive enzyme activity. However, green tea compounds may interact with blood-thinning medications such as warfarin. Many adults over 60 take anticoagulant therapy, so professional consultation is essential before regular use. Taste and texture may also reduce long-term adherence for some individuals. While potentially beneficial, this method still does not directly supply new collagen building blocks. 4. Aloe vera gel combined with vitamin E, EL. Aloe vera has been studied for its soothing and anti-inflammatory properties in various soft tissues. One compound within aloe, known as acemonin, may stimulate fibroblast activity in laboratory settings. A study published in the Journal of Indian Society of Periodontology reported reductions in pocket depth when aloe gel was applied locally. Vitamin E acts as an antioxidant, helping protect newly forming tissue from oxidative stress. Applying a small amount of pure aloe gel combined with vitamin E oil to the gum line overnight may prolong contact time. Extended exposure may provide a more favorable environment for cellular repair compared to brief rinses. Individuals managing diabetes should exercise caution, as aloe may influence blood glucose levels in some cases. This combination is relatively affordable and easy to obtain, which may improve consistency. While it may support soft tissue recovery, it does not directly rebuild jawbone density. For that reason, additional foundational support may be necessary for comprehensive improvement. 3. High hyaluronic acid gel, left on overnight. Hyaluronic acid is a naturally occurring molecule present in connective tissues, including the gums. It functions as a hydration scaffold guiding cells and maintaining moisture within the extracellular matrix. In periodontal therapy, topical hyaluronic acid has been investigated as an adjunct to standard cleaning procedures. The International Journal of Dental Hygiene reported improved outcomes when hyaluronic acid gel was used alongside professional care. Unlike rinses, a leave-on gel remains in contact with gum tissue for hours, especially when applied before sleep. Prolonged contact allows the compound to support hydration and potentially assist cellular organization. Maintaining moisture is particularly important in older adults who often experience reduced saliva production. Although hyaluronic acid does not directly create collagen, it may enhance the environment for repair. Consistency is required, and visible changes typically develop gradually rather than immediately. This approach addresses tissue support more effectively than quick surface rinses. 2. Vitamin K, 2-MK7, and vitamin D3 for bone support. Gum health cannot be separated from bone health, especially in adults over 60. Vitamin D3 plays a critical role in calcium absorption from the digestive tract. Vitamin K2, particularly in the MK7 form, helps direct calcium into bones rather than soft tissues. Research in the European Journal of Clinical Nutrition has shown improvements in bone mineral markers with consistent K2 supplementation. Healthy jawbone density provides the structural anchor that gum tissue requires to remain attached. Without adequate mineral support, even strong collagen cannot compensate for weakened bone foundations. These nutrients should be taken with a meal containing fat to enhance absorption. Individuals on anticoagulant medications must consult a physician before using vitamin K supplements. Bone remodeling occurs slowly, and improvements may take several weeks to become measurable. Nevertheless, addressing bone density targets one of the most fundamental drivers of gum recession. 1. Collagen. Peptides with ubiquinol form of CoQ10. Collagen. Peptides provide amino acids such as glycine and proline, which are essential for collagen synthesis. Hydrolyzed collagen is broken into smaller peptides that are more easily absorbed through the digestive system. Studies on collagen supplementation have demonstrated increases in connective tissue collagen production over time. Coenzyme Q10, particularly in the active ubiquinol form, supports cellular energy production in mitochondria. Fibroblasts require energy to produce new collagen fibers efficiently. Research in periodontal medicine has associated CoQ10 supplementation with improvements in gum inflammation markers. After age 50, the body's ability to convert standard CoQ10 into its active form declines. Using ubiquinol may bypass that conversion step and enhance cellular energy availability. Combining collagen peptides with ubiquinol addresses both structural material and metabolic energy. This dual approach supports tissue repair from within, rather than only treating surface symptoms. Consistent daily intake on an empty stomach may optimize absorption and delivery to connective tissues. Improvements are typically gradual and depend on adherence and overall health status. Morning supplementation with hydrolyzed collagen peptides and ubiquinol may provide foundational support. Waiting at least 30 minutes before eating allows amino acids to be absorbed without competing dietary proteins. In the evening, applying either aloe vitamin E gel or hyaluronic acid to the gum line may enhance local repair conditions. These topical options should not replace brushing and flossing, but rather complement them. Vitamin K, 2 and D3 can be incorporated several times per week with meals containing healthy fats. Maintaining regular dental cleanings remains essential to remove tartar and monitor gum status professionally. Hydration-balanced nutrition and avoidance of tobacco further improve oral tissue resilience. Tracking progress with periodic photographs may help individuals notice gradual changes. Realistic expectations are important, as connective tissue remodeling takes time. Consistency over 6 to 12 weeks is often necessary before meaningful improvement is observed. Collagen supplements should not be taken simultaneously with large protein-rich meals to avoid absorption competition. Alcohol-based mouthwashes may dry gum tissue and should be avoided immediately after applying repair gels. Sudden discontinuation of prescribed dental or medical treatment without consultation is strongly discouraged. Individuals taking blood thinners should seek medical advice before using vitamin K2 or concentrated green tea products. Mild digestive adjustment may occur when beginning collagen supplementation, but persistent discomfort warrants professional evaluation. Always choose high-quality supplements without unnecessary sugars or artificial additives. Reading labels carefully helps avoid hidden ingredients that may undermine overall health. No supportive strategy replaces the need for professional periodontal assessment when symptoms worsen. Persistent bleeding loose teeth or severe pain require immediate dental examination. Safety and informed decision-making should guide every step of your oral health plan. Aging does influence collagen production and bone density, yet decline is not always irreversible. Modern diets often lack the traditional nutrients that once supported connective tissue and bone strength. Earlier generations consume more natural collagen through bone broths and less processed food overall. Today, targeted nutritional support may help bridge that gap responsibly and thoughtfully. Your body retains remarkable repair capacity even after 60 when given appropriate support. Protecting your gums preserves not only your teeth, but also your confidence and ability to enjoy food comfortably. Approach these strategies patiently, consistently, and in partnership with your healthcare professionals. Small daily habits practiced steadily over time often create meaningful long-term results. Healthy gums contribute to overall wellness, digestion, and quality of life in the later decades. Caring for them today is an investment in comfort, dignity, and independence tomorrow.